The main concepts of EMDR include adaptive information processing, which was developed to explain the observed results of EMDR therapy delivered to individuals experiencing trauma and PTSD. The AIP model hypothesizes that maladaptively stored memories of trauma create obstacles to rational processing of information, which occurs in the prefrontal cortex of the brain. Another main concept of EMDR is the three-prong approach, which includes the past, the present, and the future. The therapist works with the client to create a treatment plan, which will consist of some past events, i.e., the trauma, and how that past trauma is impacting the client presently with whatever symptoms or triggers are happening, and any future outcomes the client is wanting to have. That's the three-prong approach, reflecting on the past, how the past is impacting the present, and any future outcomes or goals that is desired. Also, another concept is bilateral stimulation, which can soothe and calm the client's nervous system, enhancing the client's access to positive images, thoughts, emotions, and body sensations. EMDR therapy uses bilateral stimulation, which is right and left eye movement. This is a bilateral stimulation, or tactile stimulation, which is the tapping, or sound, which can be done on the ears, which repeatedly activates the opposite sides of the brain, releasing emotional experiences that are trapped in the nervous system. This allows the brain to store traumatic memories in an adaptive memory network, i.e., reprocessing. Lastly, one of the main concepts and the biggest takeaway are the phases of EMDR. There are 8 phases, which should always be followed. Phase 1 is history tracking. That's where you learn the client's history. This is where a lot of the treatment planning also occurs. Phase 2 is preparation. That's where you create a safe, calm place for the client. You teach them grounding techniques, breathing techniques, coping skills, etc., and prepare them for EMDR, providing them with education and ensuring that they are able and ready to begin EMDR. Phase 3 is the assessment, which activates the memory network for every client. You should always be available to begin phase 4 if you're starting phase 3. Phase 4 is desensitization, which you'll be able to observe in our role play. And phase 5 is installation, which you'll also be able to observe in our role play. The phase 4, which is this desensitization, will include bilateral stimulation and working with the client to desensitize the trauma or the negative memory. And the installation is helping install positive cognitions into the client. The cognition is something that the client comes up with, and the brain is reprocessing the traumatic memory or event on its own. The therapist is guiding the client, but the client's brain is doing the work. So, phase 5 includes positive installation. Phase 6 is a body scan where the therapist will ask the client to scan their body to see if any sensations are left over. If there are any sensations left over, you will continue with the desensitization until there is a clear body scan. Phase 7 is closure. This is where you ask the client if they need anything before they head out. You want to make sure you have enough time to wind down with the client to exit out of the reprocessing, possibly doing grounding techniques if that's what they need. If they're fine to go, then they can head out, but you want to check in with your client to make sure that they're good to go. You also want to talk to your client about logging any triggers, images, cognitions, emotions, or sensations. We refer to that as TISES. The client will have a TISES log where they can log those things, and they would bring those back into the sessions to continue to work on them and clear those out. You will also remind them to use their safe, calm place or other techniques that they've learned. And then phase 8 is the reevaluation. Phase 8 starts at the beginning of every next session once you've completed EMDR. So you would start your next session with phase 8, which is the reevaluation phase.